Welcome, everyone, to this presentation on hypertension or HTN. Let's start with an overview of what hypertension is. Hypertension, also known as high blood pressure, is a chronic medical condition in which the force of blood against the walls of arteries is consistently elevated. Blood pressure is measured in millimeters of mercury, mmHg, and normal blood pressure is generally considered to be 120/80 mmHg. When blood pressure consistently exceeds 140/90 mmHg, it is considered hypertension. Now, let's dive into the pathogenesis of hypertension. Hypertension can be caused by a number of factors, including increased peripheral vascular resistance, increased cardiac output, increased sympathetic nervous system activity, dysfunction of the renin-angiotensin-aldosterone system. These factors can be influenced by a variety of lifestyle and genetic factors, as well as underlying medical conditions such as diabetes and kidney disease. The criteria for diagnosing hypertension include 2 or more readings of blood pressure above 140/90 mmHg taken on separate occasions. It's important to note that a single high reading does not necessarily mean someone has hypertension. Multiple readings are needed to confirm the diagnosis. Now, let's talk about risk factors for hypertension. These can include age. Risk increases as people get older. Family history of hypertension. Obesity. Physical inactivity. Tobacco use. Excessive alcohol consumption. Stress. Certain medical conditions such as those prescribed for diabetes and kidney disease. There are several ways to prevent hypertension, including maintaining a healthy weight, eating a healthy diet rich in fruits, vegetables, and whole grains, reducing salt intake, engaging in regular physical activity, avoiding tobacco use and limiting alcohol consumption, managing stress, treating underlying medical conditions that may contribute to hypertension. Now let's talk about hormones that affect hypertension. There are several hormones in the body that can impact blood pressure regulation, including renin-angiotensin-aldosterone system, RAAS. This hormone system plays a major role in regulating blood pressure. When blood pressure drops, the kidneys release renin, which converts angiotensinogen to angiotensin I. Angiotensin converting enzyme, ACE, then converts angiotensin I to angiotensin II, which causes vasoconstriction and stimulates the release of aldosterone, a hormone that increases sodium and water retention in the kidneys. This increases blood volume and can lead to an increase in blood pressure. Antidiuretic hormone, ADH, also known as vasopressin, is a hormone produced by the hypothalamus and released by the pituitary gland. It regulates water balance in the body by increasing water reabsorption in the kidneys. In people with hypertension, ADH levels may be elevated, which can increase blood volume and raise blood pressure. Cortisol is a hormone produced by the adrenal gland in response to stress. It can increase blood pressure by promoting vasoconstriction and increasing blood sugar levels. Chronically elevated cortisol levels may contribute to hypertension. Thyroid hormones, including thyroxine, T4, and triiodothyronine, T3, play a role in regulating metabolism and cardiovascular function. An imbalance in thyroid hormone levels can lead to hypertension. Estrogen and progesterone, these female sex hormones, can impact blood pressure in women. Estrogen can cause vasodilation and lower blood pressure, while progesterone can cause vasoconstriction and increase blood pressure. Hormonal fluctuations during the menstrual cycle and menopause can impact blood pressure in women. It's important to note that hormone imbalances alone are not the sole cause of hypertension, but they can contribute to it in combination with other factors such as lifestyle and genetics. Treatment for hypertension may involve medications that target these hormone systems, such as ACE inhibitors or aldosterone antagonists. Finally, let's talk about the clinical manifestations of hypertension. Hypertension is often referred to as the silent killer because it may not cause noticeable symptoms until it has reached a severe stage. However, some people with hypertension may experience headaches, shortness of breath, dizziness, chest pain, vision changes, In conclusion, hypertension is a common and potentially serious medical condition that can be caused by a variety of factors. It's important to diagnose and manage hypertension to prevent serious complications such as heart attack, stroke, and kidney failure. By understanding the pathogenesis, diagnosis criteria, risk factors, prevention strategies, and clinical manifestations of hypertension, we can work to prevent and manage this condition effectively.